Joint pain has a way of shrinking your world. Tasks that used to be automatic, tying your shoes, climbing a flight of stairs, picking up a grandchild, suddenly feel like obstacles. If joint injections have been part of your treatment, you have probably asked a very reasonable question. How many can I safely get in a year? There is no single number that fits every person. The right answer depends on which joint is being treated, what type of injection is used, how your body responds, and what your provider recommends. But there are general guidelines worth understanding because they exist for your protection. Let's start with the most common type, corticosteroid injections. These deliver a powerful anti-inflammatory medicine directly into the joint, often mixed with a local anesthetic for quicker relief. They can reduce swelling and calm pain, sometimes for weeks or even months. Most clinical guidelines, including those cited in the Journal of the American Academy of Orthopedic Surgeons, suggest limiting corticosteroid injections to roughly 3 to 4 times per year in any single joint, with at least 6 weeks to 3 months between treatments. A 2017 study published in JAMA found that repeated corticosteroid injections in the knee were associated with cartilage volume loss over time. That is why frequency limits exist. Not to withhold relief, but to protect the joint itself. Weight-bearing joints like the knee and hip carry additional risk with repeated injections, so providers tend to monitor those especially carefully. Other injection types follow different schedules. Hyaluronic acid injections, sometimes called gel injections, are used most often for knee osteoarthritis. They are typically given as a series of 3 to 5 injections, spaced about a week apart, and can often be repeated roughly once a year. They work by restoring cushioning fluid in the joint rather than reducing inflammation directly. Platelet-rich plasma injections, known as PRP, use concentrated material from your own blood. Research on PRP is still developing, and frequency guidelines are less established. Many providers start with 1 to 3 injections and assess response before moving forward. Here is what matters most in practice. If your injections are wearing off faster than they used to, or if you feel like you need them more and more frequently, that is important information. Not a reason for frustration, but a signal to bring to your provider. It may mean another approach, or a combination of approaches could serve you better. Injections work best as one piece of a broader plan. Physical therapy, movement, and other treatments your provider recommends can help you get more from each injection and protect your joints over time. The National Institute of Arthritis and Musculoskeletal and Skin Diseases at the NIH emphasizes that osteoarthritis management is most effective when it is individualized and comprehensive. No single treatment does everything. So here is your practical takeaway. Before your next appointment, write down how long your last injection provided relief, how much it helped, and whether your pain has changed. That information gives your provider exactly what they need to build a safer, smarter plan for you.